Vice President Yemi Osinbajo launched the Lancet Nigeria Commission report, which calls for One Nation, One Health. This new narrative is an initiative of a multidisciplinary group of Nigerian academics based within and outside the country. The report identifies bold recommendations for action in collaboration with policymakers, contributing to sustainable change on health policy, as well as programming of national health outcomes and the global health goals. What are these recommendations and the modalities in place to ensure successful implementation, aimed at giving greater impetus to the Nigerian health space? Our focus is on this and more on this episode of Health Options. Thanks for joining us on the program. I am Rabi Abdullah. If you're just joining us, this is Health Options, and as we discuss the Lancet Nigeria Commission report, which calls for One Nation, One Health, let's first of all take a look at the launch in Abuja.
With an estimated 206 million population and still growing, Nigeria, partners say, must reposition future health policies to achieve universal health coverage as Africa works towards 2030 targets. Inaugurating the Lancet Nigeria Commission, Vice President Professor Yemi Osinbajo re-emphasized the importance of domesticating health financing.
And we believe that the health of Nigerians does matter, and we've therefore focused interventions on the people living in the rural areas, women, and of course vulnerable populations.
Professor Osinbajo also reiterated the need to have a rethink on health security through digitization.
Government should lead the development of standards for the digitization of health records, better data collection, registration, and quality assurance systems.
Key players in Nigeria's health space made recommendations on prioritized health investments.
I want you to look at what we have in place as our health infrastructure today and see how to transform and revolutionize that health infrastructure so that it is responsive to the needs of the people.
You need people from multiple disciplines, including law and anthropology, to come up with the right answers to the myriad of challenges that we face.
Partners also suggest engaging communities to address issues of vaccination, maternal care, and health financing.
Joining me now in the studio for more insights into the report is Ibrahim Abubakar, Dean, University College London, Faculty of Population Health Sciences. He is a professor in infectious disease epidemiology. Welcome to Health Options, Prof.
Thank you very much for having me.
Oh, I'm so excited about this new narrative, because we all know that the health sector, the health system, the indices, coming from Nigeria, even though the federal government had been doing what it could, but we really can't say we are where we wish to be. And I'm just so glad that something new is happening. And when I got to see the people behind it, your humble self, Dr. Sani Aliyu, Dr. Chikwe Hekwaza, and co, I can name, you are just many, and I see a ray of hope. And that's why we have you here in the studio today to quickly take us through the current situation, which you feel as experts within the country and outside are not happy with and want to see, a change in the status quo of things?
Thank you. Yes. So as a group of Nigerians, we're as passionate as all our other fellow citizens that there's a distinct opportunity to move us from where we are with multiple health challenges to a situation where we're as the best in the world and as good as anybody else. Our report identified that these challenges are numerous. There's no shortage of statistics that shows Nigeria to be performing less than the potential of our nation. For example, we have the largest number of kids under 5, children under the age of 5 in the world that die before the age of 5. It's also sad that if you look at maternal mortality ratios, the only countries we are better than in the world are Chad, Sierra Leone, and South Sudan. Now, I think that everyone would agree with me that is not where Nigeria should be. We should be right at the top of the African continent in terms of how good we are, and we should be performing with the global best because we have the talent, we have the people and the innovation to deliver on the best outcomes.
Okay. We know that if we go by the popular saying that a healthy nation is a wealthy nation, and we know that, you know, on that premise, government has not really rested on its arms to see that, you know, it's, you know, sees an improvement in the health status of the populace, you know, and, you know, going beyond that. So what do you think is responsible for what seems to have been, you know, the slow pace of our improvement, and how do you think what you are bringing on board now could make a difference, and just how?
So we start with the idea that health is wealth, and you're correct. But for health to be wealth, you have to put your money where your mouth is. You have to essentially invest in health at the right levels. But it's not just about investing in health. It is about spending the resources wisely. So our report is a comprehensive analysis of all of the evidence. We've spoken to people and we've extracted the best of our history and previous reports, and we've used the best science available and data to put forward specific recommendations that can take us through our numerous implementation challenges through better governance, better mechanisms for accountability, and specific areas of intervention in terms of the wider determinants of health and prevention of ill health, but also the health system, digitization so that we can collect better data, healthcare workers and the issue of how we ensure that they are appropriately supported to deliver better healthcare, and the governance of that health system so that the outcomes that people get when they encounter the health system is better. We consider the issue of financing in a great deal of detail and have proposed innovative mechanisms in how revenue for health can be raised, with a particular recommendation that we need health insurance for the 83 million poorest Nigerians who cannot afford to pay. At the moment, we spend as much as our neighbors across West Africa, and the outcomes we get is less than theirs. So we need to invest the right amount of money, and it's not a lot of money. For 15,000 naira per person, you can get basic health care to our people annually. And if we do that and improve the quality of care they're getting, then we should be able to get to where we want to be.
I just want to, you know, from your own observation and the like minds that, you know, who sat down to come up with this, where are we getting it wrongly? Where are we getting it wrong?
So we believe in terms of the buy-in for health. As the COVID-19 pandemic has shown us, health is one of the most important things you can do. And it's not just a mere rhetoric when we say health is wealth. Health is wealth because with a healthy population, you can get the right workforce to move Nigeria in the right direction. So the big story in our commission and in the report we've produced is this idea that for most nations to get people to believe in the country and to be patriotic, the country has to offer them something. And the idea of one nation, one health is that there needs to be a new social contract between our governors and our people, our leaders and the population, to ensure that by providing universal health coverage, i.e. paying for the insurance premium for the poorest and making it mandatory for employers, those that are formally employed, building on the National Health Insurance Scheme and the state health insurance schemes, we get coverage to levels that are 80, 90, 100%. If you do that and combine it with interventions to improve implementation, and we have specific costed interventions in the proposal, showing, for example, that if you just put in modest amounts of increases in the monies that we're spending currently, of the order of an additional 5,000 per person in our health system, you could reduce mortality in areas like child health and in maternal health into millions of people. So the cost of not doing what we recommend is actually millions of deaths unnecessarily of Nigerians. Our report purposely takes an optimistic but yet pragmatic view. We recognize that those challenges would not be solved in a day. So we set out recommendations that should be done today, but we take a 10-year time horizon so that it will be gradual and effective.
Wow. I'm looking at something that that's the report now, tilting towards more towards health security. Is it because most of you are epidemiologists, or I don't know?
No, absolutely not. So actually, again, on purpose, we realized that to solve the challenges we face, you need multiple disciplines. And on our commission, we brought together anthropologists, lawyers, economists, doctors, other health professionals, and we have a whole spectrum of expertise that allowed us to think about the problem more broadly. Of course, health security is important, and that's actually an area that Nigeria has done remarkably well. You mentioned my colleague, Dr. Ihekwezu, who is now at the World Health Organization, and our response to COVID-19, and before him, our response to Ebola was world-class and world-leading. We also did things like eradicating polio. Many were skeptical in the world, but Nigeria delivered and we eradicated polio. So we start from a good position. Sometimes the pessimism and the narrative that we can't do, people start to believe it. And I believe Nigeria has the talent and what it takes. We just need to put our money where our mouth is and change the rest of the system to build on things like the Basic Healthcare Fund and actually implement them and plug the leakages and get those resources to our people to provide care for children, pregnant women, and everybody who needs healthcare.
Okay, I need you to be specific now on your recommendations towards primary health care, because that's the bedrock.
So you're absolutely spot on there. So our report focuses extensively on the subject of primary health care. We believe that that is where the majority of our population, that 83 million I mentioned, the majority of their health problems needs to be delivered there. It is therefore right that the Basic Healthcare Fund has put aside the National Primary Healthcare Agency and the respective primary healthcare agencies as the mechanism through which a large chunk of that will be delivered. But what we call for is for an expansion of that to ensure that not only the right level of resources are available, but the quality system, so that each of our primary healthcare centers have got the right level of staffing, the right level of systems to ensure quality, but also the right infrastructure to get the care to our people. And I'm therefore pleased that Dr. Faisal, the director of the National Primary Healthcare Agency, is working with colleagues to do a summit next week that would look at the potential for reimagining primary healthcare, building on the recommendations of our report.
Do you think Nigeria as a country has a complex peculiarity when it comes to, health needs and all of that? How do we strike a balance in such a way that we get to achieve this one health, one nation, one health mantra?
So, I'm very clear that we are special. Nigerians are unique in all sorts of ways. But another way of looking at it is other countries have complexity. Just look at the vastness and variety of India, or indeed countries like Brazil. So it is not impossible to combine diversity with some level of coherence. What we recommend in our report is a combination of centralization of the elements that need to be centralized. So the thinking about the quality and guidelines of your care, your information systems, your ability to purchase in bulk, your ability to manufacture things like vaccines and drugs, those need to be coordinated centrally. But we think that should be combined with thoughtful localization. At the very local level, you need to do things like the actual delivery of the care that you provide, and you need to adapt the health packages to the cultures and norms of our people. And we provide evidence and example of how others have done it, and we think that that's the appropriate way to get buy-in. So one nation, one health actually combines some level of centralization, but with thoughtful localization.
I know data is an issue. I know it's a huge problem, in our healthcare planning and all of that. So can you just let us into how things, could be done differently? How, data should be prioritized for us to get the other things right?
Yeah. So we all know information is power. In health, information is power because it allows you to plan, but it also allows you to deliver accountability. If you know that things aren't going right, then you can change them. Only things that you know about that you can change. It allows you also to deliver better quality care because health professionals need information to know what's the latest treatments. We therefore have made that a major element of our report. In the work over the last 2 years, we looked at the national health systems, the state health systems, and we conducted specific audits in hospitals and health centers around the country. Sadly, we found huge gaps. There are whole hospitals that are not reporting data in some specific areas. We therefore took a step back and thought, what is new and innovative that the nation can do? I think everyone will believe me that the rate at which over the last 20 years mobile phone technology has penetrated even the poorest places in the country is remarkable. Even the places facing insecurity, you can get data and you can get a telephone to use. So our recommendation is the answer lies in not enforcing rigid systems that are paper-based or particularly based on a desktop computer, but to think about how we empower health workers with digital technology on their phones to be able to collect this information and seamlessly pass it on to managers and publish those results. So when we collect the data, use them to show how we can improve the delivery of healthcare. Fortunately, not only do we have those funds, but actually the technologies and the software to do this already exist, and we should just go ahead and use them.
This is the beginning. A launch has taken place. What next? What's the immediate result that we should expect to see? Because it's a work in progress for an initiative that has a 10 years life cycle. What are you going to do next after this launch?
So we said at the launch that this is actually the start of this journey. We're very clear that we're in it as Nigerians for the long haul. And our plan, starting with this engagement and getting people to hear about the report, is to consistently continue engaging wider civil society, the Nigerian Governors Forum, our legislators who would produce the right laws, health policy makers. We think health should be in all policies. Health should not just be the business of the Ministry of Health. If you want to improve nutrition, if you want to improve sanitation, you need the whole of government to be engaged. It's therefore our intention to engage both at the state and at the national level with policy makers to continue with finding avenues to get our recommendations into action. I'm therefore delighted that the Vice President, His Excellency, Professor Yemi Osinbajo, launched the report, and that as chair of the Health Reform Committee, he provides one particular avenue, and several of us authors of the report are also members of the Health Reform Committee. So that would be one immediate path that we can begin to get our thoughts. I intend to, through Governor Fayemi, engage the Governors Forum and deliver some of our recommendations to be digested, adapted, and utilized appropriately by our states and the commissioners of health respectively, and engage them in a conversation, because ultimately thinking is the first step to action, and we need those to be adapted to the particular circumstances of each of our states and our local governments.
As we pursue universal health coverage, we know that our healthcare financing is not something we've really gotten widely in terms of how to finance it, because some people have talked about taxation, some people, because it's about, you know, striking a balance between both the informal and formal, you know, component of the society now. So what are you suggest? What did you recommend in that regard?
So I suppose the first point to make there is the tragedy that at the moment the system we have is not right, in part because over 78%, about 78% of expenditure is out of pocket. The difficulty with that and the challenge with that is that for the poorest of our citizens, that means that when they have a health illness or they're unwell, they could end up with what we call catastrophic expenditure, which essentially messes up their entire life and their family's future because they are paying for healthcare.
Or some just even give up.
Indeed.
They just give up. They
Indeed,
don't
and needless loss of life.
Yes.
So we think that given the peculiarities of our country and learning from what has happened elsewhere, what we need is a combination of approaches. And we present a hybrid system that relies on innovative taxation and collection of revenue. For example, a small amount, say a kobo on each minute of a mobile phone, or the newly announced taxation around sugar, repackaging those resources, looking at things like petroleum subsidy, which is really unequal. It benefits the elite and not the poorest. Collecting revenue from that sorts of sources and paying for the poorest citizens. Managing that appropriately and ensuring that there are no leakages. And then mandating that for the rest of the population that are in formal employment, there should be legislation that says it is compulsory to do so. And the journey on that has already started. Many states already have mandatory health insurance, at least the legislation. We now need to get to implementing it both at the state and at the federal level. If you combine the two, our calculations and modeling suggest that we will get to a point where the majority of Nigerians have health insurance coverage. You then need to use that raised revenue, which would be quite large, to enforce improvements in quality. Because if you're a purchaser with the right amounts of resources, you can insist that hospitals, doctors, and manufacturers that provide revenue give you good value for your money.
And I know that we still have some ailments that are still more donor-driven. What have you got to say in terms of Nigeria taking ownership, total ownership? Can we not do that?
Absolutely. I think the adage, looking the gift horse in the mouth, comes to mind. And this literally means when somebody is gifting you something, you need to stop and think about, is that what I really need, or is the person giving me because that's what they need? And with a lot of help that we receive, the agenda of the people trying to help us is quite different from the needs of our people. So my view very much is that we need a collective approach. The donors have an intention to do good, but with an interest in specific area. We need a lot better coordination by our political leaders on the receipt of those gifts so that they don't go to individual agencies and individual channels with the offer to do good in one specific area and direct our agenda. I believe we need to take a step back and say to all of the donors, this is what Nigeria needs and this is what you want you to pay for. Others are doing so. If you go to Ethiopia, if you go to Ghana and you want to help, then you have to do what they want. And I have no doubt that we are an even better place than those two countries to demand that these are the things that they can help us with. And if they don't want to help, there are other places they can go to.
We're in a political era, politics gearing up. Very soon we will get to see new leaders, taking over mantle of leadership and all of that. What would you be saying to Nigerians now as the electorates, where it has to do with those we vote into power, as it concerns better healthcare delivery for the nation?
So my view is very much that the right things to do are the right things to do, irrespective of which political party is in power. Our recommendations are evidence-based. We looked at the best of science and looked at our track record in Nigeria and made those recommendations. So our wish would be that both political parties, I say both, there are actually quite a few parties in the country. So all the political parties look through our recommendations and get the best ideas and put it to our people, and that people should decide, looking at those, to support those parties that would make a difference to their health.
I want you to give me a projection of what Nigerians should expect, all things being equal, after 10 years of this, your report and what you're proposing.
So our ultimate vision is that our recommendations lead to a future where there is universal health coverage, where the average Nigerian citizen can walk to a health center, a primary health center, and get the care that they deserve. I also believe that if we did all the recommendations and implement them correctly, we can also prevent a sizable amount of ill health. And the investment in health is actually a wise investment, because the more you invest in health, you generate economic activity in health itself. So you recover some of the revenue that arises from that. There will be greater employment, and health could actually be that avenue where in 10 years' time, Nigerians will be proud of their country, and one nation, one health, and that new social contract becomes true. And I'm looking forward to that future.
So it's actually possible to have a public health system that works for all?
Absolutely.
Thank you so much, Professor Abubakar Ibrahim, for coming on Health Options. We'll keep track of your activities and see how far you could go. But I really, really wish you the best of luck, and I hope this new era of thinking, this new narrative will take us to the promised land, if not totally, but somehow. Let's see a better health, outcome, and, a better healthcare delivery in the country. Thank you so much for coming on Health Options.
Thank you very much for having me, Rabi. It's been a pleasure.
That does it on this episode of Health Options. A quick reminder that you can watch the upload of these and other episodes of the program on our YouTube channel. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.